Good afternoon, dear students. So today we are going to discuss about radiation effects, radiation safety, and patient protection as well as education. Okay, this is an important chapter for you because you're going to ensure all these steps every day in your practice in radiology session. So we all know that radiation is harmful. So, what kind of radiation is harmful? We say ionizing radiation is harmful. Okay, so you now know what is ionization. Ionization is the process by which an atom which does not have a charge is split into a negative and a positive ion. Okay, so to make an atom which does not have any charge to a negative and a positive ion, there should be some source of energy which is splitting the atom into these ions. So that is called as ionizing radiation. Okay, so we have two types of ionizing radiation. One is called as particulate, or the other is in the form of waves, which we call it as electromagnetic radiation. So we are more concerned about the electromagnetic radiation because that is the one that we are commonly using for the diagnostic or therapeutic exposures. Okay, so all ionizing radiation is harmful to the tissues because it produces biological changes in the living tissues. Okay, so any radiation which produces biological changes, we are going to make sure that such radiations are going to have limited exposure on the living tissues. Okay, so the amount of radiation, X-rays, used in dental imaging is, even though it is very small, biologic changes can occur. Okay, so what we have to do, all individuals, they can have a maximum permissible dose. So maximum permissible dose is the dose which a person can be maximum exposed to before having any harmful changes in the tissue. For example, there is a person X and there is another person Y. So X works in a dental clinic in which there is no radiation protection, and Y works in a dental clinic where there is radiation protection and safety measures ensured. So, what happens when X is working in this radiation unit for, say, 1 year? Maybe X is exposed to 10 units of radiation. And why? Because there is radiation safety and protection methods ensured, then Y may be exposed to 2 or maybe 3 units of radiation. So, what is the net effect? So, according to guidelines, if you are exposed to more than 5, you are going to have harmful effects on your body. So, this person X who is working in a dental clinic which does not practice radiation safety and protection is at risk of or have developed harmful changes in their tissues. So it is always important to make sure that if you are working in a clinic, you have to have a measurement of the radiation exposure. Okay, if a measurement is not there, then it is possible that you are exposed to harmful changes. Okay, so did you understand about this? The importance of radiation and to know about its measurement? Okay, great. So, dental units, as discussed here, they have a very minimal radiation exposure. Okay, it's around 0.02 percentage of the total exposure a person might have in a year. Okay, it's called as annual radiation exposure. So, being a dental assistant and knowing that maybe you can be posted in a radiology unit or you might take x-rays, you have to also ensure that you yourself is practicing safety as well as protecting your patient with radiation exposures. Okay, so the entire x-ray area is considered to be a radiation hazard area. So this area should be marked by a hazard sign which should be posted outside the unit so that all people and the patients can see. Why? Because if the sign is not posted, okay, radiation area, authorized personnel only, then during an exposure, a patient might open the door and get exposed to radiation, or another staff or personnel working in the unit can expose to radiation. So usually there is a red light that is advised to be present outside the room where there is radiation exposure to alert the patient and the staff in the clinic not to open the door when the red light is turned on. Okay, so this is a hazard sign which is indicated that there is a radiation zone in this area. So ionization, as we discussed, it splits an atom into negative and a positive ion. So this type of reaction or process, it can result in harmful effects of X-rays in the human tissue. Why? Because the ionization process, it can cause disruption. Disruption means breakage or discontinuity of cellular metabolism. So cell performs metabolism, anabolism, and catabolism. Anabolism is building up of energy, and catabolism breaking down of energy. Okay, so they can cause a disruption or breakage in the normal cycle of the cellular metabolism, and they can also cause permanent damage to the living cells and tissues. So we have to always make sure that we ensure maximum protection to both us and the patient. So biological effects. So biological effects means any change in the biological tissue which can occur. Okay? Biological effects means any change in the biological tissue which can occur. Okay, so exposure to radiation, this can bring about changes in the body chemicals, cells, tissues, and organs. The effects of radiation may not become evident for many years. Okay, after the time the x-rays were absorbed. This means that, for example, a patient is undergoing CT scan for 3 times per year for 2 years because of his disease condition. So the patient is also working in a radiology unit and he is also having much exposure to the sun. So, such a person can develop a harmful effect because of the radiation, may not be on the following year, may not be 5 years later, but definitely after few years, it might show up. So, this time period where the radiation was exposed and the effect was shown is called as latent period. So, latent period means the time when the radiation was exposed to the patient and then when did the effect of the radiation come into effect. Okay, it is called as latent period. So we say that the latent period for this patient is around 10 years or 15 years, means that he was exposed to a radiation source 15 years back and now he has developed some effects because of it. Okay, so that is called as the latent period. It's usually asked for your exams. Now, cumulative effects of radiation. So the term cumulative means stacked, okay, one on the other, or a total number. Okay, so 1 plus 1 plus 1 plus 1 equals 4. So 4 is the cumulative. number. Okay, so cumulative effects of radiation means that how much radiation you have been exposed to over a period of time or over a lifetime. Okay, so exposure to radiation always have a cumulative effect. Okay, so every day when you go out in the sun, you are getting exposed to radiation, UV radiation, infrared radiation, what all kinds of radiation from the cosmic rays, like that. Okay, so next is how to identify these effects, the cumulative effects of radiation on the tissues. So, when these effects occur on the tissues, some damage occurs and they are repaired. But tissues, they do not return to their original state if there is too much exposure. Okay? Acute radiation exposure and chronic radiation exposure. These are the first two things that you have to know about the effects of radiation on the tissues. So, what is acute? Acute, as you know, the term means in a short period of time, and chronic means long period of time. So, if radiation exposure occurs in a short period of time in large dose, then it is called as acute radiation exposure, such as in the case of a nuclear accident. Okay, nuclear accident means like if there is a nuclear exposure to people working in a nuclear power plant. Okay, so it is called as a nuclear accident. A nuclear power plant is where energy is generated. Okay, so sometimes there is nuclear fallout means there is a problem or an explosion with the some of the units which emits huge amount of radiation within a fraction of seconds. So that is called as acute radiation exposure, very harmful and has very um, large effect on the tissues, which can even cause malignancies, leukemias, or burns, or even death of the patient. Okay. Now, chronic radiation exposure, it is over a long period of time, and the dose will be small amounts. Okay, so chronic radiation exposure is the one that you, me, as personnels working in the radiology unit, that should be aware of and should protect yourself from. Okay, so a dental assistant or a dental radiologist or a dental technician or whoever is working in the radiology unit is always at a risk of chronic radiation exposure. Okay, so chronic radiation exposure occurring over a longer period of time in very small amount of doses. Another example is a tobacco smoker. Okay, so tobacco also has some constituents or substitution substance which can emit radiation, like polonium, uranium, all elements like this. Okay, so what happens when a person smokes tobacco over a long period of time? There is some mild amount of radioactive substance that is emitted. This, over a period of time, can result in cancers, or you can say malignancies, lung cancer, oral cancer, or respiratory tract cancer, any of these. So, such effect is called as chronic radiation exposure, meaning to say, small amounts of radiation exposure occurs over a long period of time. Okay, so the question for you is here. So here's your question. You can answer A or B. So, exposure to radiation is the amount of exposure a patient is absorbed to or exposed to, and the number of units of radiation the patient absorbs is called as absorbed dose or dose. Dose equivalence is the sum of all the radiation that the patient is getting exposed to. Okay, 3 units of radiation measurement, that is exposure, dose equivalence. It has 3 units as well. Coulombs per kilogram. Gray, dose equivalence is measured in sieverts. Okay, sievert is the unit that you are going to commonly see when it comes to the exposure measurement for you as a person practicing in dental radiology. Okay, so here, maximum permissible dose. So maximum permissible dose, it is defined by the National Council on Radiation Protection and Measurement as the maximum dose equivalent that a body is permitted to receive in a specified period of time. So you have a period of time and you'll be monitored over that period of time, and you'll be measured what is the maximum dose that you had got exposed to during that period of time. So usually it is collected as a total during 1 year. Okay, it's measured over 1 year. So maximum dose equivalent. Okay, so maximum dose equivalent is the third one here. So it is measured in sieverts or rem. Okay, so let's see how much dose you can have. For occupationally exposed persons, that means, for example, a person working in the radiology unit, which can be assistants, operators, the radiologist, anyone. Okay, so over a period of 1 year, they can have 5 rems per year, or it's equivalent to 0.05 sieverts per year. So you should be knowing the measurements of both in rems and in sieverts, because you can get questions either in this level or in your licensing exam in any of these units. Okay, so if you want to remember it easily, always remember, if you divide rem by 100, you will get sievert. Okay, so divide rem by 100 means 5 divided by 100. Okay, so what happens here? 1, you have 2 zeros here, so 1 0, 2 0, and put a dot. Okay, so that is the sieverts per year. Okay, so an occupationally exposed person, like a person working in a dental radiology unit, they can have maximum 5 rems per year or 0.05 sieverts per year. For occupationally non-exposed persons like the patients, they can have zero point 0.1 rem per year, or if you convert it into sieverts, it's 0.001. So why is this less number? This is because occupationally exposed person, we know that the patient's occupation is in the radiology unit. So every day the patient is working in that area, so you can measure the dosage that the patient is exposed to. Okay, but for non-occupationally exposed person, we do not know how much radiation the patient is getting exposed to from the dental radiographic exposure. He can get exposed to a CT scan. He might be a person working in sun exposed areas, that means outdoor worker. So you have to make sure that we keep their dose to be minimum, that is 1 rem per year. It's equivalent to 0.001 sieverts per year. Okay, so for occupationally exposed is 0.05 sieverts per year, and for non-occupationally exposed it is 0.001. Now, for any dental personnel, they should try to get the occupational exposure to 0 by following strict radiation protection practices. So, if you follow the strict radiation protection practice, then you will not be exposed to any sorts of radiation. Okay, and also you have to keep in mind that this dental personnel working in the radiology unit should not exceed the maximum accumulated lifetime dose. Okay, that means over every year, collectively over a period of time, this patient should not be exposed to maximum dosage. Okay, now before going into the radiation safety portion, you have to also know about the pregnant female. Okay, a pregnant female can have a maximum dose of 0.005, okay, per gestation. Per gestation means per pregnancy. Okay, so occupationally exposed is 5, non-occupationally exposed is zero point 0.1, and for pregnant female it is 0.005, the least. Okay, per gestation. Gestation means per pregnancy. Okay, per pregnancy. So this is for a pregnant female. Okay, so during pregnancy you're supposed to give the patient a maximum dose of 0.001 0.005 rems per year per gestation. Okay, so I hope you understood the difference between pregnant female, occupationally exposed, and non-occupationally exposed. Okay. Now we'll go to the radiation safety. So radiation safety, we have background radiation, we have cosmic radiation, we have artificial or man-made radiation like the medical or the dental sources. Background radiation means from the natural sources, which can be from the ground, which can be from the air, or which can be from the internal food items that we consume. Okay, cosmic radiation means from the space, artificial or man-made, that is created by us. Now, protective devices. So what are protective devices we should be having? The X-ray tube head, they should be equipped with appropriate aluminum filters, lead collimators, and position indicating device. And the equipment, that is X-ray equipment, it should be checked on regular basis by a federal regulating agency like the FDA. So here you have SFDA. So SFDA, they all per year they visit all the areas where radiology units are set up, and they make sure that the units are functioning properly without a radiation leakage. Faulty or malfunctioning equipment should be repaired immediately. So this means that the X-ray machine which has a radiation leakage, it should be repaired immediately as soon as there is a leakage found. Okay, so that is why SFDA or FDA ensures proper radiation safety protocol. Okay, now protective devices. So we discuss about aluminum filter that occurs inside the X-ray tube. So when a machine is operating greater than 70 kVp, the aluminum filtration should be 2.5 millimeter thickness of aluminum. If a machine is operating less than 70, then it should have 1.5 millimeter thickness of aluminum. Okay. Collimator is the one which looks like a CD. It will restrict the beam to an area that is equivalent to size 2 intraoral film. So this is going to significantly reduce the patient exposure. Okay, now the position indicating device. So here you can see an 8-inch PID and a 16-inch PID. So what do you think? Which one is better? See the exposure coverage of the face. So which one will you prefer? You'll prefer an 8-inch or you'll prefer a 16-inch? Yes, 16. So 16-inch will have lesser diversion of radiation. Okay, so here you can see when the X-ray cone or the PID is small, there is more divergence or spreading of the X-rays. When it is long, there is less divergence and less exposure to the face. So we always want the lesser areas. So we always prefer a long PID like the one that is there in our lab. It has a long PID or position indicating device. So filtration 2.5 millimeter thickness at 70 kVp or greater. Then the collimation should be there. PID should be there. Now regarding patient protection, lead apron and thyroid collar. So lead apron should be protecting the patient from all areas which are sensitive, like the reproductive tissue, blood forming tissue, from scattered radiation. Very important. You are protecting the patient from scattered radiation, not the direct X-ray radiation. Okay, thyroid collar. So it is flexible lead sheet that is placed around the thyroid collar to protect the thyroid from, again, scattered radiation. So we are protecting the patient from scattered radiation by using the lead apron. It can be asked for your exam. So we use lead apron to protect the patient from what kind of radiation? The scattered radiation. Okay, so the collar may be separate or it can be found together with a lead apron. Just to remind you, the intraoral exposures has lead apron with thyroid collar, and extraoral exposures does not have a thyroid collar. If it has a thyroid collar, it is going to create a artifact or an object on the radiograph which is actually not present. Okay, so we do not want to repeat the radiograph and get more radiation exposure for the patient. So we do not use the thyroid collar. So you can see the lead aprons here. We have a lead apron without thyroid collar. Here we have it with a thyroid collar. Now, if you have observed, the lead apron in the lab is hung to the wall. Okay, it is hanged on to the wall, or if it is in use, you are going to either hang it on to the wall after the patient, or you are going to keep it on a rounded bar. Okay, so the rounded bar is to make sure that this lead inside the lead apron does not crack. Very important question. If the lead in the lead apron is folded or crushed, then there will be cracks in the lead apron which causes radiation leakage. So now this is the reason why we hung the lead apron or we hang the lead apron onto the wall after exposure. Or if you do not have an area to hang it out, then you are going to lay it over a rounded bar. Okay, so that the lead sheets are intact inside the lead apron. Now, using a fast speed films. If you use a film which has more speed, then you will have less radiation exposure. So speed means the amount of radiation exposure a film needs to get exposed to radiation. So fast speed film means less amount of radiation exposure to the patient. Okay, so the main factor on the film that determines the speed is the silver halide crystals. The larger size the crystals are, the faster the film. So the fast speed films, they are used both in intraoral as well as extraoral film based radiography, so that the effective dose of the patient is reduced to the maximum possible. Now next is the image holding or image receptor holding devices. So here you can see that this image represents don't hold your film with the thumb, or you can say finger retention. You can see the cone that is used here is also a short cone, which should not be there. So, always, if possible, try to use the image receptor holding devices rather than the patient's finger to being exposed to radiation. Okay, so you can have disposable holders or sterilizable holders. So if your clinic has any of them, then you have to use it for better practice. Exposure factors. So using a proper exposure time will also reduce the amount of radiation exposure to the patient. If you want to take incisors, you have to select the incisors rather than the molars. Okay. So if you consider these factors and ensure proper setting, then your patient will also be safe. Proper technique. So you kept all the parameters correct. The control panel parameters, you made the patient wear the lead apron, the thyroid collar, made him or her sit down very nicely. And if you are not using a proper technique of radiation exposure or the quality of the film is not good, that means you're going to repeat the radiograph. So images that are not diagnostic, they have to be retaken. Okay, because you cannot interpret from a image which is not giving you diagnostic information that you are looking at. So you have to make sure that you ensure less patient radiation exposure by using a proper technique without any retakes. Pregnancy, as we discussed, we have to make sure that the patient's exposure should be zero. Okay, so how to do that? By using the lead apron. So if the patient wears a lead apron, the exposure to the pelvic region is actually zero. Okay, if you use a lead apron, the exposure to the patient is zero. The embryo and the fetus receives no detectable exposure with the use of a lead apron. So, do you need to defer the radiographic exposure for a pregnant female? Now, this depends upon the situation. If the patient has to undergo a non emergency procedure, you can defer or you can postpone the radiographic exposure also. But if the patient has come for an emergency procedure and the dentist wants to see what is inside, for example, a road traffic accident, there is a foreign object inside the mandible, then definitely we have to see the radiograph, take the radiograph and check for it and to remove it out. So, such emergencies or emergency because of a tooth pain, acute dental pain, if you need a radiograph to find out whether the tooth is fractured, or you can just do a access opening and keep it, that means open the tooth for the pus to drain out. Which one should we choose? For that, maybe you can take a radiograph. So when you take that radiograph, make sure that the patient wears a lead apron to make the exposure to the fetus zero. So even in pregnant female, you can safely practice intraoral dental radiography. Okay,
Did
it is not a restriction. Yes, my dear.
um, they have been telling us that it's not safety for a pregnant woman during the first semester, during the first 3 months, even if she's wearing lead apron. Is this correct?
Okay, there are two schools of thought. Okay, so that's why I said to you about the situation. If the patient does not require an emergency dental procedure, you can always postpone the radiographic exposure and the treatment as well. But if the patient has come to you for an emergency dental procedure and it requires a radiograph. If you put the lead apron on the patient, the exposure to the fetus is zero. Okay, so basically, it is safe when you make the patient wear the lead apron. But if your dental clinic does not have a lead apron, you should not be exposing any radiograph on a pregnant female. Okay, did it clarify your doubt?
Yes, yes, Doctora. But they said the dentist said even we have never ever take radiograph for pregnant patients at least until the first semester. After the first.
First trimester. The reason it is said is because in the first trimester, if you are getting the patient exposed to radiation without a protective equipment like lead apron and thyroid collar, then the patient's fetus, that is the baby, can have genetic mutations, which can lead to mental retardation. Then the tooth is not developing, and brain is not proper, or the IQ is not that much good. So these all problems can occur only when your patient is not wearing a lead apron. Okay, but if the patient is wearing a lead apron, and if it's an emergency procedure, only emergency. Okay, if it's an emergency procedure, of course, when it comes to the dental clinic, a pregnant female with a emergency procedure, they always do not require a radiograph, and you do not usually do a dental procedure in a pregnant female unless the patient is on the second trimester, where it is safe to make the patient lie down for dental treatment. So, if the dental treatment can be deferred, that is the first thing you should be doing. Okay? Non emergency procedure, always defer until the pregnancy is complete and the patient delivers the baby. So, it's all between the patient to saying that it is an pain. The patient cannot withstand the pain. So the dentist needs to see the cause of the pain. If on clinical examination the dentist suspects a fracture of the tooth or a cyst or something like that, which requires immediate dental, okay, immediate dental treatment. In that case, you can take a radiograph because intraoral radiograph is not going to cause much exposure. Okay? And you are making sure that the patient is having zero exposure to the making the patient wear the lead apron. If a pregnant female is not protected with lead apron, then none of us is protected with the lead apron, because the main function of the lead apron is to make sure that your reproductive organs and the pelvic area is having zero exposure. Okay, so always remember that pregnant female, you should consider about this procedure, the type of procedure, emergency, non-emergency. If it emergency, does it require for radiograph for a better treatment or better treatment plan? If it's going to have a marked change, for example, a patient comes with a broken tooth and you have to extract, so you have to definitely take a radiographic exposure. So of course you'll prefer an intraoral radiograph over extraoral one in the patient. Okay, patient can be intraoral radiograph with the apron preferably on both sides. You can use lead apron on in the front and one side in the back, and then the exposure. Okay, I hope it clarifies the doubt. So now, the patient protection, what are the things that you can follow? Lead apron, thyroid collar, postpone non-emergency radiographs for pregnant women, All measures should be taken for proper film exposure. Film holding devices can be used. So, because now we are using um, digital radiography, we can also use sensor holding devices. Fast films, if you're using films, if you are going to use digital radiograph, then the radiation exposure is going to get reduced by 80% than a normal film. So it is much better for a patient. Well calibrated, properly installed X ray machine equipment. So when you follow these guidelines, the patient exposure is very, very minimal. Okay. Now coming to your operator protection. So dental assistant is always at a risk of chronic radiation exposure. Okay, they must use proper operator protection measures to avoid occupational exposure to radiation, including primary radiation. That means you should never stand inside the X ray room, leakage of the radiation, so that you are not exposed to any kind of radiation, primary or scattered. That is why the FDA or SFDA makes sure that the radiation instruments that you use are properly standardized and there is no radiation leakage. Then safety guidelines should be followed and use of radiation monitoring devices. Very important. If you're working in a radiology unit as an operator, to provide operator protection, you always have to use a radiation monitoring device. Okay, so a radiation monitoring device should be always worn by the patient. You should be wearing it. Okay, so a dental assistant who fails to follow the rules of radiation protection by not wearing a radiation monitoring device, standing in the line of x-rays inside the x-ray room, using an x-ray machine which has radiation leakage and which has been discarded, these things can cause radiation exposure to you, which is called as chronic radiation exposure. So if a dental assistant doesn't follow the principles, the assistant can get exposed to chronic radiation exposure. Okay. Now, what will you do? If you have a room, come outside the room and press the exposure button. So the room acts as a barrier. If you do not have a room, there will be a lead barrier. This is made of lead. Okay, so once you arrange everything inside the patient, go to the back side of the lead barrier. This glass that you are seeing here is also having lead inside. It's a leaded glass tube. Okay, so here again the scattered radiation will not reach you. So come back onto the area of the lead barrier and do the exposure. So your exposure button will be here. So if you have a room, come outside the room and do the exposure. If you have a lead barrier, go behind the lead barrier and do the exposure. Now, what if you don't have both? If you don't have both in your clinic, then what will you do? So this is your patient, and this is the patient's nose eye region, and this is the X-ray beam. Okay, so in this case, the X-ray beam is coming from front. So in such a case, if there is no barrier or no room in your dental clinic, what you should do? So this is the direction of the X-ray beam coming inside, okay, and this is 90 degrees, okay, towards the side. So another 90 degrees. So this total is 180 degrees, okay. So this is 90 degree, okay. When you go more down, it becomes, okay, this total is 180. Let me draw. So that is marked with the red is 180 degrees, okay, and that is marked with the blue is 90 degrees, okay. So if you are here on the X-ray beam, if you walk until here, it is 90 degrees. If you walk beyond this line, it is going to be 90 and this is 180. Okay, so 180 means one half side, and 90 means half of one half side. Okay, so what is these numbers and degrees? So when a barrier is not there, what you should be doing? You have to stand 6 feet away from the patient. First point. 6 feet means 2 meters away. So first stand 6 feet away. Where? Okay. Between 90 degrees and 135 degrees. So this is 180 degree. Okay, this total is 180. So when you come, you should walk here and stand in this area. Okay, so this green zone is the area where you should stand, that is between 90 to 135 degrees at a distance of 6 feet away. So if you are somewhere here in this region, you have maximum protection from radiation, that is scattered radiation, from reaching you. Okay, so always outside this area, 6 feet away. Okay, if you stand within 6 feet, there is no radiation protection. So this is the primary beam direction. That means, for example, you are taking the maxillary, central incisor, or mandibular incisors. So the radiation is from the center. So in that case, you can stand at the back side of the patient, either on the left side or on the right side, 6 feet away at an angle from 90 to 135 degrees. Okay, now what if the x-rays is coming from the side of the patient, like if you're doing a molar exposure? So this will be the direction of your primary beam. So in that case, from here to here it is 90 degrees, and from here to here this whole is 180 degrees. So you are going to stand somewhere here. Okay, so you can either stand here or you can stand on the back side in this region. Okay, so making sure that you never stand in the line of primary radiation coming out from the x-ray machine. So where should be you standing? 6 feet. Where is your position? 90 to 135 degrees from the primary beam. So this will make sure that you do not have any radiation exposures. Now, radiation monitoring. Radiation monitoring for you as a dental assistant or a personnel working in dental unit should be always carried out. So how will you do that? First, you have to do a monitoring of the equipment for any radiation leakage, and you have to monitor yourself by the use of any three types of these monitoring device. Monitoring means they are going to monitor you, they're going to check you, okay, whether you are having radiation exposure or not. So three kind of devices are possible. One is called as the film badge. Okay, so a film badge is like a rectangle box. It has a slot and it has something written here, and here inside this you have a film. So your name will be written, and the time of the year or time period where the badge is measured. For example, the date will be written. Okay, so every 3 months you are going to give this badge to the monitoring center, which monitors the radiation exposures, and you will get another badge. So basically you are going to have two badges. So you, this badge, you are going to use it, and after 3 months you will give this badge and you will get this badge back. Okay, it's called as badges. Okay, so film badges is one type of radiation monitoring device. Next is pocket dosimeter. Pocket dosimeter, it looks like a pen, but it has a reading on the pen with the date. Okay, thermoluminescent device, or you can say TLD. It is most commonly asked question from the three of them, but you can get question on film badges or pocket dosimeter as well. But thermoluminescent device. Thermo means thermal energy. Luminescent means illumination or glowing device. So here, what they mean to say is that when radiation falls on this instrument, this is going to glow and record the radiation exposure. Okay, so TLD, thermoluminescent device, film badges, and pocket dosimeter. These are the three things that you are going to use to monitor the radiation exposure to the patient. Okay, or to the, sorry, not patient, to yourself. So a dosimeter, it's asked for your exam. What is a dosimeter? It's a device that can be used to measure the amount of occupational exposure. Okay, amount of occupational exposure can be measured with the device which is called as dosimeter. And the common type used is the film badges. So film badges, they contain a film packet similar to the dental film that is embossed with the, embossed means it has the name of the person who wears it with their identification number. The badge is worn at all times while the employee is at work. So if you are working in the dental unit, in the radiology unit, you are going to wear it all the times while you are inside the unit. Okay, now there are some instructions for use of this film badge or any radiation monitoring device that you use. So these devices are going to be measured for exposure every 3 to 4 weeks, or you can say 1 month period of time. So some measurements are done at least in minimum of 3 months. Okay, so here the company processes the badge and prepares a report which contains the radiation exposure results for that period of time, for that 3 months or 1 month or 6 months or 1 year. And also they give accumulated report for quarterly, that means 3 months, yearly, that means 1 year, and lifetime exposures. That is, for example, if you worked for 20 years in that unit, you will get an exposure when you are going out of that place or company. You'll get the exposure results. Okay, so every quarterly, every 3 months means a month has a year has 12 months. So every 3 months, if you are going to measure the radiation exposure, that means you are going to measure 3 into 4, 4 times in a year. Okay, because 1 year has 3 months, 3 months, 3 months, 3 months, 12 months. Okay, so how often you are going to measure? Quarterly, yearly, and lifetime. So every month you will give the badges for measuring the exposure that you had, or every 3 months. And then you are going to get the measurement for every year and over a period of your practice in that area. Okay, or with that company. Now that is about the personal monitoring device. So these badges, they should not be worn. It should not be worn outside your office. Okay, especially in the bright sunlight. If you wear it outside the working place, outside in the sun, then you're going to get more radiation exposures, okay, on the badges, and they're going to record it. So what will happen by the end of the year or in the 3 months, if they see that your badge has been exposed to radiation, there are two possibilities. One, that you had gone out of your work during that period of time and you can have some problem with at your work. And number two, they will think that you are exposed to radiation, so you'll be getting a voluntary leave not to work during 1 month at least. Okay, so these radiation monitoring devices, they should not be worn outside the sunlight area. It should be removed when you are taking an exposure for yourself. For example, if you want an exposure for your molar, maxillary or mandibular molar, you will remove this device and keep it aside, and then you will get exposed to radiation. You should not be using it while you are taking an x-ray for yourself. Okay. Equipment monitoring, you are going to monitor the equipment for the leakage, except for the primary beam that is emitted from the radiograph. So this can be a fault in the seal, a leakage of the radiation can occur. So this is available to be monitored with the use of the device by the health department. So this is what you call as a film badge. Okay, and this is an example of thermoluminescent dosimeter. Okay, you can be asked for your exams, identify this instrument. It is a film badge. Identify this instrument. This is a thermoluminescent dosimeter or device. Equipment monitoring, you can use something called as ionization chamber that you keep inside the room to check for radiation leakage. Now for pediatric patient who are unable to cooperate, then ask the patient to sit in the parent's lap in the dental chair. So in such case, you should be making them both wear the lead apron, both the parent and the child. Okay, so having the parent hold the film or sensor in the patient's mouth is acceptable for the patient, and this will need only a single exposure for the parent. So if the assistant were to hold the film in this manner, you will be suffering from a radiation exposure. This will lead on to the cumulative effects of radiation for you because you are constantly working in the unit. So make the patient and the child, the child patient and the parent wear the lead apron, and then you do the exposure for the patient. So your main aim is to keep the radiation exposure as low as possible. That is called as ALARA concept. It's a principle of radiation protection for the patient. As low as reasonably achievable. Okay? Always asked in your exam, what do you mean by ALARA? It's as low as reasonably achievable. So how can you keep the radiation exposure to zero? Never stand in the direct line of the primary beam, which comes out of the X-ray source. Always stand behind a lead barrier or a proper thickness of a drywall, which we call it as 9-inch thick, or if you have a room, come out of the room and then do the exposure. Because the door for the room will be made with lead lined inside. Never stand closer than 6 feet from the X-ray unit during exposure, unless you are behind a lead barrier. So if you have a lead barrier, stand behind that. If you do not have it, stand at right angles to the beam at a position more than 90 and less than 135, in between that, okay, at a position of 6 feet away.